Most people think they know what a heart attack looks like. A person suddenly grabs their chest. They collapse. Everyone panics. An ambulance rushes in. That dramatic scene is what movies show us. But in real life, heart attacks are often far less obvious, and that misunderstanding has dangerous consequences. Because many people wait too long to get help. They assume their symptoms are not serious, or they convince themselves it must be something else. Indigestion, stress, a pulled muscle, fatigue from a long day. But here's the truth. Not every heart attack starts with crushing chest pain. Some start with discomfort that feels vague and confusing. Pressure in the chest, a strange tightness in the upper body, a heavy feeling that does not quite feel like pain. Others start somewhere completely different. The jaw, the shoulder, the upper back, the arm, even the stomach. Some people feel sudden nausea. Others feel extreme fatigue that appears out of nowhere. Some people simply feel short of breath, and nothing else. This is one reason heart attacks can be missed early, because the symptoms do not always match what people expect. In fact, many patients who arrive at the hospital later say the same thing. They thought it was something minor. They thought it would pass. But the heart does not wait. Every minute matters when blood flow to the heart muscle is blocked. The longer the blockage remains, the more damage occurs, which is why recognizing symptoms early is critical. But to understand why these symptoms vary so much, we need to understand what is actually happening during a heart attack. A heart attack occurs when blood flow to part of the heart muscle becomes blocked. This blockage usually happens in the coronary arteries. These arteries supply oxygen-rich blood to the heart itself. Over time, fatty plaques can build inside these vessels. This process is called atherosclerosis. Most of the time, these plaques grow slowly, but sometimes a plaque suddenly ruptures. When that happens, a blood clot can form rapidly. The clot blocks blood flow through the artery, and the heart muscle beyond that blockage begins to suffer from lack of oxygen. This is called ischemia. Without oxygen, the heart muscle begins to weaken. If blood flow is not restored quickly, the affected muscle can begin to die. This is why early treatment is so important. But here's where symptoms become complicated. The nerves that carry pain signals from the heart also share pathways with other areas of the body. The brain sometimes interprets the signal as coming from the arm, the jaw, or the upper back. This is called referred pain, which explains why some people feel pain far away from the chest. Other times, the symptoms are even more subtle. The heart may simply struggle to pump effectively. That can cause shortness of breath, lightheadedness, or sudden fatigue. And certain groups are more likely to experience these atypical symptoms. Women, people with diabetes, older adults. Their symptoms can be especially subtle. Sometimes the first sign is simply feeling unusually weak or sick. This is why heart attacks are sometimes missed or delayed. But there are still warning patterns that should never be ignored. There are several symptoms that should always raise concern when they appear suddenly. Pressure, tightness, or discomfort in the chest that lasts more than a few minutes. Pain that spreads to the arm, neck, jaw, or upper back. Sudden shortness of breath, unexplained nausea, cold sweats, lightheadedness, or unusual fatigue that feels completely different from normal tiredness. Sometimes symptoms come and go. They may feel mild at first, but mild symptoms can still signal a serious problem. If something feels wrong in your body, do not ignore that signal. Time is one of the most important factors in heart attack survival. The faster blood flow is restored, the more heart muscle can be saved. Modern treatments can reopen blocked arteries, but those treatments work best when patients arrive early. Waiting hours can significantly increase damage, so if symptoms appear suddenly and feel unusual, seeking medical attention quickly can make a life-saving difference. Heart disease remains one of the leading causes of death worldwide, but awareness changes outcomes. Recognizing symptoms early gives people a chance to act quickly, and that quick action can save heart muscle, and sometimes save a life. This video is educational and not a diagnosis. If you ever experience symptoms that concern you, always seek immediate medical care and follow the guidance of healthcare professionals.